So this class would be about the something that we both didn't tell you how it's called, this postural imbalance. The most common postural imbalance we have on a modern 21st century in culture. It's called the upper cross syndrome. It's a syndrome which means it's very common. It's called the upper cross because it involves neck and shoulder and upper back. And it's a cross because there is a cross between certain muscles like the rhomboids and middle trapezius that is too long, and certain muscles that are too short, like the front of the throat, the front of the neck, and too short is the pectoralis muscle as well. And among others, like the trapezius muscle, the neck muscles. So, just to be sure that we understand that it's not only a shoulder problem, but also upper back, in which there is an increased kyphosis. Yeah? And that's actually the primary cause. When you're sitting, you see what happened is that movement happened and then the neck fixed. So we need to look at shoulder, neck, and also upper back, which is increasing kyphosis. So first of all, before you start working even, few remedies to help. First of all, you can use bolsters in the right place, and you can put the bolsters this way or different one, even double fold them, and then I want the camera to come closer, and then lift yourself and put this underneath, yeah? Good. Because what it does, it brings the shoulder back even a little bit, even further back to its original place. Is it too much or comfortable?
That's fine.
Yeah? Okay. So then you can cover it, and you can actually massage other areas while the shoulders push backward to its original place. Okay. And I'm just going to reduce that a little bit. Yeah? Lift yourself, lift your shoulder, good. Now, few errors is first, if you're putting it not really in, then actually it may slide out and it's uncomfortable, okay? So try to keep it quite in, and I'm gonna do only one side in here. Then you bring that back, tuck this under, and you can start treatment. Okay? So.
Would you always support the upper arm as well when you're bringing the shoulder back?
It's nice to support the upper arm. So it's not so nice to do that. Yeah? Because what happened, it actually creates a roundness around it, and it's nice to keep it this way. Yeah? So when you treat this area, the upper back, a lot of the time, because of the increased kyphosis, there is also reduced movement and muscle rigidity. So what you're doing, you need to come really close to. And if I can have a skeleton, yeah, thank you. What you're doing, and that's again, of course, after you can bring it to see my. After you taking the full consultation, you see that the client is healthy. You see there is no rheumatoid arthritis or osteoarthritis. Only then you can do this technique. Only when the client is well. So what you're doing actually is you start moving the spinous processes on the upper back. Yeah. So you're pushing them, and by then you're mobilizing between the vertebrae, and you stretching slightly the muscles, the deeper muscles of the spine. In practice, how you do that? You're palpating the spinous processes. You come to your side, and then you start pushing it in, and you're actually mobilizing them quite lightly. It's make it light and continuous. It's a small movement, So don't push strong, small movement.
Is that colourful, like creating a...
Yeah. You create a small gap in like that. If this is two vertebrae and you're just moving them like that, you're allowing more movement in between. Yeah? But when it comes to the neck, you don't do it. Neck is too vulnerable for that. And how do you know where the neck is? C7, the lower vertebra of the spine is very prominent. It's this one. It's very prominent, and you would feel a bigger transverse process. Sorry, spinous process, which is that one. So you know, above that, you don't go. Not in this technique, okay? So you can do it here, this way. It might be too tender, so you can do it with your base of the wrist, or two of them. So it's a very short lever, because you're moving on the spine itself, you don't need much. And it could be quite effective, because that's the area would have a lot of tension of just increase the kyphosis all the time. Good. Good. You can work on the erector spine a little bit this way, but mostly slight movement. You can even hold the spinous processes this way. You see how the head move. So it's not hard work, it's just precise work. Yeah? Good. So we can do that. There are a lot of kind of pectoral stretches this way when you're bringing it, but it's quite hard work. So I'll show you other technique, yeah? I'll show you other technique. And a lot of therapists really like this technique, you know? But as we discuss, I'm not sure that it's really needed. It might be feeling good, and there is a place for this technique, but really you're overstretching a muscle that is already stretched, yeah? So, yeah, it's nice to work underneath the scapula, on the ribs, yeah? Good. Okay. Beside that, you can come and do another technique. Come around, and the camera can come from here, which is pretty much the same thing from above. So imagine that there is an increased kyphosis. So what you're trying to do is stretch it a little bit. So you're allowing the spine to go back, and every time, if this is increased kyphosis, you're just bringing it back to a neutral position. You can do that with one hand, or I like with oil, you need to stabilize there. So you do it this way. Now, when it comes there, it's ineffective because my body is too far and I don't need it. I need it mostly in there. Now, what do you think about this technique here? Not good, right? Even, look, shake his head, no. So you need to feel where the C7 is, go maybe one or two, and I put this hand here just so I can stretch it a little bit. Yeah, and then if it's getting to be freer, you can do a little bit more. It's very tense area, so really work nicely through that. It's a bit of shaking as well, can be done there, yeah. And you have to always measure what's the give. If there is a give, go with it. If not, ease off, work more moderate. So it could be that you're starting just by doing that. That's it, really.
But this would only be effective if the pectorals are stretched, is that right?
More, yes, it will be more effective. You can do that without it, but the pull would not allow as much. So actually you're kind of bringing this whole area. I want you to see that. Relax your shoulders. Do you see how this area is now more lax, now stretched more? Laxed, and you're trying to build this laxity by putting the shoulder backward without them using any muscle. So it will be easier. Okay, good. Then you can do a little bit more traction this way. Good. Let's move on to sideline, please. So come and face me, please. Yeah, face me. Yeah, on the side, on the side. Yeah, on the side. Yeah, come a little bit up. Any more
You've got
pillow?
two on him there.
Oh yeah. Okay. Let's have them. Good. You can do that. It's that's not enough. Yeah. Good. Okay. Is this good? Remember we talked about the position of putting the shoulder, the pillow. So this is not right. Lift your head, please. That is better. Yeah. Cool. Okay. Then you can work in this position a lot better on the spine and the pectoral muscle. First of all, the spine. You can come from here, and you need actually to kind of spine to go forward and the shoulder backward. So you can do it in one go, yeah? Or from here, you know, pushing the spine. I'm actually, you see there is, on the palm, I have two areas. I have it's called thinner eminence, or the thumbs, and the hypothinner eminence, this area. In between there is a bit of a groove. This is where the spine goes, in between, so you're not pressing on it really. And actually you kind of improve the flexibility of it. It's a bit of a game. It's not very serious, so you need to have the rhythm correct. Yeah? And every time add a little bit more. And your position is quite important. So look at my knee, the front knee. Yeah? A lot is happening with it. Can I go deeper? Or? Okay. Then you can do one more thing. Let's change position. You can work with your knee, not on the spine, but in between the spine and the shoulder blade, and then you need quite an easy movement to stretch it. Do you feel the stretch? Good. And again, you can maybe do a bit of light mobilization in this area. But be sure that you're not on the spine itself, you're in between. If this is too hard, try again. Put one hand, but it's a lot harder because you really do need an opposed position, and I find it quite hard to do it with the other hand. Okay. Then another more soft tissue technique is working on the pectoralis muscle itself. But I want you to observe that it's a lot more holistic. It's not only the pectoral, it's the shoulder, the upper back. So one thing you can do is, maybe we'll lift your head a little bit, is if you can, and that depends if you have a female or male client, you can put hand on the chest bone and really just blender all of it, getting more movement. Yeah? This way. Yeah? Coming back to the pectoral, you can do a bit of soft tissue here, and you can add it with mobilization. So you can put your finger on the pectoral muscle, find a tender point, and then very slow work on increased movement. Is it too much, or how is it?
That's fine.
Yeah. Good, and then when you find a stretch, you can increase it. Let them breathe and relax. You can reduce the stretch a little bit and then work on the thoracic area. Yeah, very important. Not forget the ribs. It's quite big area to avoid. So give it a nice a nice oscillation, because there's so many muscles there. You can't work on all the muscles. You need more like a community therapy there. Or you can do it with your arm here. Again, the aim, reduce the kyphosis. I think for now is load.